Okay, if you're thinking about joining us here today, you'll probably want to do this either on a carpeted surface or on a yoga mat. If you have hardwood floors, yoga mat and bare feet is probably the way to go. If you have a carpeted surface, you don't need the yoga mat. You can wear shoes, you could do it barefoot, either way should be fine. We got just a few minutes before I start the exercises, but I did want to start by talking a little bit about what my method is. My method stems a little bit from when I was a personal trainer back in the 90s, and my experience was that my clients would always hold their breath whenever they were doing crunches or any sort of core exercise at all. So as a result, my experience was that as I was saying, okay, Mr. Smith, let's do some crunches, and he would proceed to do some crunches, and he would go, and then I would say, Mr. Smith, your form looks good, but maybe you should breathe. And he'd say, oh, yeah. And about 2 or 3 repetitions later, he would completely forget about the breathing again. And this was not just most people, it was everybody across the board that I ever had a personal training session with. So my point is, when I became a chiropractor, I knew instinctively that I was going to be giving exercises that the patient had to do at home and had to do correctly without me being there to say, hey, don't hold your breath, hey, don't forget to breathe. So as a result, instead of moving and doing motion-based exercises with repetitions, you're counting repetitions, which is what most resistance exercises are. Instead of doing that, I moved towards a more yoga-like positional holding exercise and breathing. Not just breathing, but actually counting the breaths. And that's actually key, because I've seen people do it, and I tell them this whole story with the breathing, and then I will send them home, and they'll come back the next day or the next visit, and I'll say, okay, show me the same exercise I showed you, and they would do it correctly, except they were just counting to 10 and holding their breath and the whole time, and then when they were done. And so it really defeats the purpose. So it really does stand to reason that that breathing is part of the core exercise. Some people might be wondering why that is. Well, there's a lot of overlap as far as the muscles that are associated with respiration and the core. You know, everybody thinks the core is just the abs. No, there's more than a dozen different muscles that are really involved with what I consider to be core. I even like to throw in some hip muscles into that category as well, because they're just so important to prevent dysfunction. So when you're talking about the core, you're talking about breathing. You could also think of it as 2 different types of breathing. Passive sort of breathing that happens when you're sleeping. You don't think about it. It just happens. Passive recoil, the diaphragm goes up, goes down. And what happens with accelerated breathing, or active breathing as I like to call it, that's not the real word, but I just like to call it active breathing, where maybe you're up and moving around and maybe you're not at rest, then that's the active breathing patterns that the associated or accessory muscles to breathing, that's when they kick in. Those are the muscles that are also defined as core. So you have to coordinate the ability to breathe and to do the core exercises at the same time. Most of my patients in pain, if their low back hurts and I ask them to bend over, that's what I get. Sorry about the noises in the background. We got a lot of construction going on next door. So that noise was not me. That was, yep, that one. So at any rate, I'm going to continue on here. I did want to go over that breathing thing. Most of my exercises will be for a 3-breath pattern. Hold, and then you come out of that pattern. That's most of them, not all of them. Pain. If you feel mild pain during these exercises, I would encourage you to try to work through it. Now that's a mild pain. If it becomes more moderate, like a 4 or 5 out of a 10 scale, that's probably the time to just stop and just wait until we get to the next exercise. If you experience that and you have any questions, I'd be happy to Facebook you or message you later and go over why that might be. I don't mind doing that when I'm not seeing patients right now, which is most of the time. I've got a little bit of time on my hands, so why not? So we are going to start with my number 1 exercise and a few variations. So, number 1 exercise, up dog. What I want you to do is lay down on the floor. If you have a mat, go ahead and use it. This is the up dog position. Most of you will do a couple things wrong. You will have your hands too far forward. Bring them underneath your shoulders. It actually makes it easier. Do not worry about how far your pelvis goes down. Gravity will do its job, and you don't have to worry about that. Do worry about your head position and your shoulder position. So look straight forward. Try to keep your head nice and high. Take 3 breaths. 1, 2, 3. Take a breath in the down position. Come back up. 1, 2, 3. Back down. Take a breath. Pop up again. 1, 2, 3. Back down. Now some of you may be saying, "Ooh, my wrist hurts, maybe I should stop." Well, if it becomes a moderate pain, I'm going to show you what to do. If you feel like you can continue to do that for 3 more repetitions of the 3 breaths, please continue, and I'll show some other people what variations they can do. The variations they can do is on the elbows. But you still have to lift as high as you can. Doing this doesn't do anything. Doing this, you might start to feel something. If you don't feel much, and your wrists were hurting in the other position, try this position variation where the feet are up and the bottoms of the feet are together. It's kind of like a frog position, but the knees have to come apart. 1, 2, 3. Good. So this is one variation you can do. This is good for some people. If you don't feel much in this position, go ahead and bend up the knees. Keep your head forward. 1, 2, 3. Take a breath. 1 last repetition. 1, 2, 3. Okay, so that's it for the up dog. Second exercise, bird dog. Opposite leg, opposite foot. They call it table in yoga. Therapy, they call it bird dog because you're kind of like a hunter's dog that's found a bird. He's pointing. So take 3 breaths. As you're breathing, I'll take note that most of you, again, will probably have your hands out in front of you too far and your knees out behind you too far. Get your hands underneath your shoulders. Get your knees underneath your hips. Switch sides. 1. You should be looking down and not forward. 2, 3. Switch sides. You should be looking down and not forward. And your chin should not be jutting down forward like that. 2, 3. 1, 2, 3. 1. Check your back leg and your front arm. Make sure that they're about the same height. 3. Some of you will be like this. Some of you will be like this. Try to level them out. 2, 3. 1, 2, 3. 1, 2, 3. That's repetition number 4. We're going to do 2 more. 1, 2, 3. 1, 2, 3. When I said 2 more, I meant 2 more on each side. 1, 2, 3. Last one. 1, 2, 3. Okay, so that's bird dog. Next exercise. There's again variations on this one. I would encourage you that even if it looks difficult, to try it anyway. Looks can be deceiving. Most people can do this one, although it does take a fair amount of effort. Bend the knees, 90 degrees if you can. That's a right angle. That takes the feet out of the equation. Try not to use your feet. I want you to try to pivot off of your knees and lift your butt up into the air. When you do that, take note, your position will probably be here with your butt behind you. I want you to be here. Try to bring your butt forward as much as you can. 1, 2, 3. Switch sides. 1, 2, 3. Good. Switch sides. Like I said, try to work through a little bit of pain if you can. If you can't, and the pain becomes moderate, it's a good time to abandon ship. 1, 2, 3. 1, 2, 3. Now the people who have done this one successfully continue to do so. Alternate sides with the 3 breaths. If you can't do this one successfully because of pain, I want you to do this one instead. Just a little bit of a hip raiser. Lay on your side. 1, 2, 3. Switch sides. Don't worry about your head or shoulder position. It's not important. You could be down here, you could be up here. I just want the legs out straight and lift. 1, 2, 3. So that's 3 repetitions on both sides. We're going to do 3 more. 1. Try to keep your foot level. 2, 3. I just noticed you can't see my foot. 1. Foot level here, not here. 2, 3. 2 more on each side. 1, 2, 3. It's harder than it looks. It's easy to do with your foot twisted out. It's difficult to do with your foot level. 1, 2, 3. I'll admit I lost count. We're going to do 1 more. I think it's 1 more on each side here. 1, 2, 3. 1, 2, 3. Okay. Okay, so that was side bridge or hip lift, whichever one works for you. Moving on, we're going to do frog, something I call stretching frog. Now this one is more traditional ab work, but I got to tell you, I hate doing crunches and sit-ups. A lot of people will reflexively lurch their head forward and give themselves neck problems when they didn't have them before. So instead, what I prefer you do is reach overhead, put your feet up in the air. I want the bottoms of the feet to be together and the knees come apart. So this is frog position. Like that. Arms overhead, but once your arms are overhead, I want you to lift your head just barely, and your arms just barely off the floor. Hold 3 breaths. 1, 2, 3. And relax everything. We'll try that again. 1, 2, 3. Good. Try that again. 1, 2, 3. This exercise works best if your head is just barely a millimeter or 2 off of the floor, as well as your arms. And again, 1, 2, 3. I know the temptation is there to want to do a full lift with a crunch. I would recommend not doing that. 1, 2, 3. I think I've lost count again, but I think we're just going to do one more. 1, 2, 3. Okay. That one, surprisingly, is difficult for a lot of people's necks. Again, I've never had anybody hurt their necks while doing that. Could be different for you. Try to work through just a little bit of pain. If a little bit of discomfort actually becomes easier throughout the exercise, you know you're golden. If the actual exercise starts to get a little bit more painful into the moderate range, that's a good time to stop and abandon ship. Okay, we're going to go to some standing exercises next. We're going to start with squat and breathe. Now, I know people are saying, oh, my knees, I can't do it. I got a meniscus problem. You squat every day. You do. You put on your shoes. You pick things up off the floor. So, my point is, do what you can. Don't worry about how far down you go. Just because it's an exercise and it's a squat doesn't mean that you can't do it. Feet about shoulder width apart. I don't want them too wide. I don't want the feet splayed out like that. Think of a distance between your feet that would be similar to what you would be doing when you're just plain old walking. That's about the distance we want. You won't be squatting down for a full squat, at least not right away. Hold, arms out, breathe. 1, 2, 3. Good. Now we'll try that again. We'll show you from the side. If you're not already sticking your butt out, please do so. 1, 2, 3. Good. If you feel like you can go down a little bit lower, this is a good time to try. 1, 2, 3. If you can look at your knees while you're doing this exercise, it's also helpful to make sure that you don't do any damage to them by making sure that your knees are hovering over your feet or to the outsides of the feet. Here, not here. 1, 2, 3. I'm going to go a little bit lower for those of you who can. Go ahead and follow me. If you can't, don't feel bad about it if you cannot. 1, 2, 3. I think that's 5, so we're just going to do one more. 1, 2, 3. Throwing in those breaths with those squats is extremely difficult. Don't feel like you're completely out of shape. Don't feel bad if you're feeling like you're having a hard time with it. Do your best, you're doing fine. Next exercise, we're going to do side lunge / stretch. I call it a lunge / stretch because it's important that for some of these exercises that you do some movement and some repetition just to loosen up some of these muscles that are commonly stiff. The repetition is better than the hold for some of these. So for this one, we're going to lunge to the side. I should preface this by saying that your feet should be wide. Most people, when I say bring your feet wide, that's as far as I go. Wider. About where your hands are. Leading to one side. Again, the knee should be to the outside of the foot. Lean this way. Knee to the outside, not to the inside. And repeat. 2, 2, 3, 3, 4, 4, 5. Keep watching those knees. 5. The nice thing about this is that you're actually doing a foot exercise too. If your knee is to the outside of your foot is actively supinating, not pronating. It's a little trick I threw in there because many of you have foot problems occasionally, and that foot dysfunction is something that almost always turns into a knee and or hip problem. Some people even call it their low back, but it actually starts with the foot. We'll call that 10. I don't know if that was 10, but that was pretty close. Okay, next one. We're going to do a wall butt bump, meaning find a wall. Get close to the wall. Get your butt about, we'll say 4 to 6 inches away. Stand up straight. Feet shoulder width apart. Knees have to be straight. Very important. Lock out those knees. Just touch the wall with your butt. Sounds ridiculous, but it's surprisingly hard because most people will slouch in order to do it instead of keep their back straight and do it like that. I'm bending my knees just to get my butt underneath this lip right here. Oh, there we go. Kept my knee straight on that one. So this one we'll do some holds and breathes. So just make it a slight one. Don't go down too far. Look straight forward and breathe. 1, 2, 3. Your butt should just be touching. You shouldn't be putting a lot of weight into it. Don't push your whole body weight into the wall. 1, 2, 3. Good. You will be feeling this in the low back. You may be feeling this in the hamstrings. I'm going to move forward just a tiny bit. 1, 2, 3. Again, like with the squats, I don't really care how far down you go. I would rather you focus on the hip position and getting the butt out first and the knees straight and focus on that. 1, 2, 3. As you can tell, I'm going a little bit lower every time. And that's only because my body tells me it's okay to do that. 1, 2, 3. And if you also notice, if you've ever seen somebody do a stiff-legged deadlift, this is pretty much it. I call it hip hinging. 1, 2, 3. Hinging at the hips is an important skill to learn because the glutes are the most strong. They're the strongest muscles in your body, and we probably use them the least. So hip hinging teaches you to use and access those very strong muscles instead of lurching forward or rounding forward and lifting with your spinal muscles. Next exercise, we're going to switch back down to some floor stuff, and I'm going to do 2 variations on this one. Arms out to the sides, leg up, twist, This is the first version. Shouldn't be too difficult for most people. We'll just call that a torso twist. Second version. This is more like what I call a windshield wiper. You do have to have some ab strength in order to maintain this. And this is a more motion-based exercise. This is not one where you'll be breathing through it, although do try to breathe and try not to hold your breath. We'll call that 5, and we'll do 5 more. Arms are straight out to the sides. Make sure your arms as wide as you can get them to increase your base of support. I think that's 7. For those of you doing this one, I'll do this one along with you. We'll call that 8. We'll call that 9. Again, you might be feeling a little bit looser, and you might be able to go a little bit further every time you do it. And that would be good if you could. Okay. We'll call that 10. We'll call that good. Next exercise we'll be doing is a plank. You could do a plank on your palms like a push-up position and your toes. You can do a plank on your elbows and your toes. So, first variation, take 3 breaths. Second variation, take 3 breaths. Third variation, take 3 breaths. Okay, and start. 1, 2, 3. Back down. I'm going to continue with the second variation. 1, 2, 3. And then the third variation. 1, 2, 3. I want you to continue to do the breathing while I describe this exercise a little bit more. I want you to continue to do the exercise. While you're doing this, you should be pushing through here or here as hard as you can. In doing so, you should have the middle of your spine be flush with your shoulder blades. What I'm seeing with most people doing planks is that their shoulder blades are popping out from their torsos. Shoulder blades are not flush. You're not using the proper core muscles, primarily serratus anterior. That's where you should be. That's a lot harder. We'll do one more, just like that. 1, 2, 3. Okay. Hopefully you got about 6 repetitions in there. 5 or 6 is good in my book. All right. We're going to start to slow things down a little bit again. And I'm working up a sweat, which I did not expect to do, so that's good. I really like the up dog, so we're going to go back to the up dog and finish up with it. Again, this is variation 1. If you have to do it on your elbows, go ahead. 2, 3. For those of you who are using palms, go back to that one. For those of you who are going to the elbows, go ahead and start up again. 1, lift as high as you can. Not here, but here. 3, go back down. Take a breath in the down position. If you're in this position and you don't feel much, try doing that frog position with your legs again. Bend the knees apart, feet together. Still lift as high as you can. 2, 3. It's easy to forget, and it's easy to just drop down like this. So I'm going to keep pestering people about that. Take a breath in the down position. All right, pop up high, look straight forward, 3 breaths. 1, 2, 3. I lost track, I lost count again. So we're gonna do just one more repetition. 1, 2, 3. Good. I want you to try this one, even if you feel like you probably shouldn't. I want you to try it and then see before you abandon ship and say that's too dangerous for me. Give it a shot. If it hurts, you can stop. This one, if you're on a yoga mat, it's going to be a lot easier. If you're not on a yoga mat or if you're on a carpeted surface, give it a try. You could also try putting a pillow underneath your knees or one pillow underneath each knee. Don't worry, it won't affect the position too much. But go from a kneeling position, try to go back down to this triangle position and back up again. Again, this is repetitions. We're going for stretching of the quads, that's the muscles in the front. Stretching of the hip flexors, that's the muscles of the front. But we're also using those muscles a little bit as we do it. If you can't do this one, if you can do this one, keep proceeding as we just did. If you can't do this one, try coming down for your butt on your heels and try popping up just a little bit. Some of you might have such tight quadriceps that you can't do that one either. If you can't do that one, just lean back just a little bit. Let's just get a little bit of tension on there. That's all you need. I'm going to go back for the last 3 repetitions. 1, 2, 3. Okay. Last exercise. I normally do this with a chair. Excuse me a second while I pull out a chair. You could also do this one on near a staircase. If your staircase is not too far, go towards that. Start off facing the chair or the staircase or the footstool or whatever you got. Facing it, feet going straight together. Feet about shoulder width apart. Pretend that each foot is on a railroad track of its own. Face the chair when you do that. Railroad tracks. Put one foot heel on the chair. Straighten out that knee as much as you can. We're just going to hold. Hopefully you're breathing. I'm not going to count the breaths. We're just going to hold this one and hopefully you can breathe through it and not tighten up because it's so painful. Switch sides. Again, your support foot, think about 2 railroad tracks. Your support foot is going to want to twist out that way. Don't let that happen. Keep the 2 feet on their own railroad tracks. Switch sides again. Try to lock out that knee. Make it as straight as you can. Really focus on the knee. If you don't feel much there, bring the toes towards you. This is much preferred stretch over toe touches. Why? Most people don't have tightness, stiffness, or inflexibility rounding their back. In fact, most people round their backs too much already. Most people do have tightness, stiffness, inflexibility behind the knees. Most people cannot fully straighten their knees, one or both of them. Sometimes it's just one. Do try to straighten it. I promise you, you will not damage anything by trying to straighten it, particularly when it's not loaded, meaning this knee is not supporting my body weight currently. You can put a little bit of weight into it if you want. Don't forget to bring the toes towards you. This is an important one. I really like this exercise. It's one you can do in a lot of different places, at work, You won't be flashing anybody. You won't be feeling like you have to go down and do toe touches. And sometimes stretches that you can do at work or in public can become a good habit to do, say, after a run or walk. This is a great one. People do have tightness or stiffness or inflexibility behind the knees, and I hesitate to say it's one muscle, because is it the hamstring muscle? Yes, the hamstring crosses the knee there. That's a group of muscles. Is it some of the calf muscles? Yes. Also the gastrocnemius, the top layer of your calf muscle, also tends to cross the knee, behind the knee. So, making sure the knee can straighten out is a very good habit to get into, with the knees slightly bent, which sitting being the main culprit. Our knees just stay bent throughout too much of the day. Yes, sitting is a new epidemic, but that's not going to change. That's related to our lifestyles. I'm not going to point my finger at people and say, hey, stop sitting so much. That doesn't work, especially if your job makes you sit, which many of us, that's where we are. And that's not going to change. Get up and move around when you can, that's great. But nonetheless, those people have to be tied to that computer or workstation for 8 hours a day. And without, even with standing desks, a lot of people have that variation desk. You could sit or stand. Sometimes it's just being sedentary more than being in a seated position. So do stretch out the muscles behind the knee. I find it to be very important for not only low back pain, but also hip pain, sometimes knee pain, sometimes even foot pain. You can get improvements in a lot of different areas. You can tell I'm spending a lot of time on this area just for that reason. So that's it. That's all I got for you for today. Looks like that was about 35 minutes. That's pretty good. Leave a comment. Tell me what you thought. And if you have any questions about your specific case, I'll be happy to take them as we finish up here. So shoot me a message on a private message on Facebook, or you can give me a call at the office. Either way, our office number is 616-301-3000. Yeah, thanks for joining us. Have a great day.